Hey there, future doctors. Welcome back to my channel. Today, we are diving into a subject that has left many medical students scratching their heads biochemistry. Ever wondered why people think biochemistry is hard at medical school? Well, get ready for some fascinating insights. Imagine you are a medical student working tirelessly to absorb vast amount of knowledge when suddenly biochemistry enters the scene. Its complex molecules, intricate pathways, and biochemical reactions can make your head spin. But fear not, because we are about to uncover the reasons behind this common perception. First and foremost, let's acknowledge that biochemistry is a fundamental science that forms the backbone of medicine. It explores the intricate workings of living organisms at a molecular level. However, this intricate nature can make it challenging for many students to grasp. The difficulty lies in the sheer amount of information that needs to be understood and memorized. Biochemistry requires a strong foundation in chemistry, biology, and even physics, as it combines concepts from multiple disciplines. This interdisciplinary approach can be overwhelming for some students. Biochemical pathways, enzymatic reactions, and metabolic processes often involve intricate diagrams and complex mechanisms. Trying to understand and remember all the details can feel like solving a puzzle without a clear picture. This complexity can make biochemistry seem like a daunting task. I spoke to few medical students to get their take on biochemistry. One student shared it's the sheer volume of information that gets to him. He felt like drowning in pathways and structures. According to another student, the abstract nature of biochemistry sometimes make it hard to relate to real-world clinical scenarios. Here's the thing though, biochemistry is not inherently impossible or designed to be a stumbling block. It plays a vital role in understanding disease, pharmacology, and patient care. With the right approach and study strategies, you can conquer the challenges it presents. Here are some effective strategies to tackle biochemistry and make it more manageable. Use visual aids like diagrams, flowcharts, and color coded models to help you understand complex pathways and processes. Visualization can make abstract concepts more concrete. Instead of trying to memorize everything at once, break down the material into smaller and digestible chunks. Focus on understanding the underlying principles rather than simply memorizing facts. Apply biochemistry concepts to real life scenarios and clinical cases. This helps to solidify your understanding and reinforces the relevance of biochemistry in medicine. Discuss and teach biochemistry concepts with classmates. Explaining the concept to others helps reinforce your own understanding and allows peer to peer learning. Remember, every medical student faces challenges, and biochemistry is just one of them. With dedication and perseverance and the right study techniques, you can conquer this subject and excel in your medical journey. So, the next time you encounter biochemistry, embrace it as a gateway to understanding the intricate mechanisms that governs life itself. You have got this, future doctors. Keep pushing forward and success will be within your grasp. If you found this video helpful, don't forget to give it a thumbs up and subscribe to my channel for more videos. Stay curious, stay motivated, and I'll see you next time.